is approval of the meeting from last year. So we need a motion.
Dr. Rogers, before we get there, can we do a roll call? Just a real simple roll call.
Oh, yes, we can. Go right ahead.
Smith,
I think you cut out, Shannon. Try again.
Barry Smith. I think he told me he wouldn't make it. Jerome Dixon. He said he may be late. Marlene Richardson, she's here. Philip Hayes,
Here.
Dan Durham,
Here.
Arthur Haley, Gail Phillips, Jay Eastridge,
Here.
Tom Rogers,
Here.
Lisa Halliday,
Here.
David Hessen,
Here.
Greg Tungett.
Okay, thank you, Shannon. Now the meeting is all yours, Dr. Rogers.
Okay, so first item on the agenda is approval of the board minutes from last year. So we need a motion to approve.
So moved.
And that was by Jay Eastridge. We need a second.
Second by
Second.
Dan.
I think that was Dan.
All in favor, say aye.
Aye.
Any opposed?
Aye.
Okay, motion carries. Second item on the agenda is health education updates.
Good afternoon. This is Tracy Aaron from the Health Department. I just want to give you all a few updates. We in health education have started doing community programs again. We are doing those virtually. We started doing some virtual classroom presentations in January in Taylor County. We are currently updating our community health assessment. So there will be an addendum to that. We've done that in 2019. So there will be a 22 addendum coming out, and that information will be on our website. As I've looked over the data, Taylor County has some areas where we've improved. Quality of life seems to have improved some. Health behavior seems to have decreased some. So I encourage you all, once that's up on our website, which will be February the 21st, to take a look at that and just look at your community data. Also, I have talked with the lady at the hospital, and I should have pulled her name out, but I know they just completed their needs assessment and they have redone their community health improvement plan. So our next step will be doing our community health improvement plan, and I plan on reaching back out to the hospital so that we can compare our data and set a plan up for the community on how to better meet those needs and improve the health outcomes in Taylor County. Also, in the spring, my intent is to hire someone to better serve the Western community or Western counties of the Lake Cumberland District. So that's something that will be happening within the health education department. That's my short update, unless you all have some questions for me.
Any questions for Tracy? Okay, well, thank you, Tracy. I appreciate that information. Next on the agenda is proposal for mini grants. Are there any proposals for that today?
No, there is not. We did not have any this year.
Okay. All right, so we'll skip that. Any old business? Okay, so
this is where I think Sean would always have recommended to you all or said at this point, if there's anything we failed to follow up on that you all have asked us about, or anything for the agency that we have not done, that's what this old business should be. Anything that it's still pending, or you were waiting for an answer from someone, if that exists, let me know and I'll try to make sure to follow up on things.
Anybody have any questions for Amy? If not, then we'll move ahead to new business and presentation of the 2021 financials and audit.
I have asked Ron to kind of go over this with you all. He's our finance manager here at the agency, and he's very familiar with their budgets and all of this. And it makes sense for me to turn over the budget portion of the talk to the finance officer. So I'm gonna let him do our presentation. I know you all have had an audit this year. He and I have looked at these numbers in depth and gone over it all. So go ahead, Ron, if you want to, and point out the high points for everybody.
Good afternoon, everyone. I wanted to, this is the actual first year I've actually included our prior year financials in our budget presentation, before our budget presentation. I asked Amy if I could start doing that. I probably should have asked Sean when he was in position years ago. We normally send those out to you guys every year, but because we sometimes have to wait on audits and everything, it takes a little while to get them fully completed, to make sure everything's tidied up and everything. So I thought, instead of having, sending out all the year-end financial information at a different time than the meeting, it'd be good to just start presenting it, and then we can kind of, you guys can get it in your board packet, and you guys can get a presentation, because I'm assuming you guys probably sometimes have questions depending on how the year went. I'm going to share my screen. So the first thing I am going to present is the financial statements that at year-end last year, and you'll see quickly that they'll correspond directly to the audit, but we'll do the audit second. But I'll go through these. I'll go through these quickly. Let me pull that up. Let's see. I think this is it. Okay, can everybody see my screen?
Yes.
Okay, and I'm going to back out that a little bit so everybody can see the whole picture on one page. Okay, so as you see, for the Taylor County Public Health Taxing District for year ended June 30, 2021, we had total receipts at the end of the year of $523,769.81. That is, of course, comprised of the normal taxes, real, tangible, motor, delinquent, and other, and some interest income that you guys have every year from your accounts. That's just from checking. You currently don't have any CDs. Your expenditures every year totaled $448,007.05, giving, as you can see, the different categories that make that up between advertising, professional, maintenance and repair, district management, materials, supplies, dues and subscriptions, grants and donations, furniture and fixtures and equipment. Those are all very normal expenses y'all have on a yearly basis. That allowed you to have a surplus of $75,762.76. So y'all were over. That's how much y'all were over budget, which is a good thing. Moving on to the balance sheet. You guys had, at the end of the year, at June 30, 2021, y'all had $503,609.04. Here in a little bit, when we do the budget, I'll give you an updated number of what you are as of December 31st currently. But at the end of June last year, you were at $503,609.04. So y'all are doing just fine on cash. And then this gives you a little picture. I'm not going to go into this in depth. I'm only going to throw out a few highlights. As you'll see, basically in every category, we were under budget. They're very immaterial in the categories we weren't. A little bit in professional services. That's auditing. That's because sometimes the auditors don't get back to us until after our February board meetings, the fee they're going to charge us. It turned out they had to go up in rate this prior year just by a little bit, by $100. So that's why that's over. But other than that, we're barely over in dues and subscriptions, which I've updated this year to cover the new costs of some of these fees, like KPHA dues and SPGE and things like that. Other than that, you were over budget in every other expense category, as you can see on my sheet here. You were well under in expenses, and in revenues, a lot of the revenues we budgeted, we were over as well. And there's that $75,000 surplus that you're seeing there, where we were over comprised of being over in our receipts and under in our budgeted expenses. That is all the financials. Before I present the audit, which is going to reflect the financials that we just went over, do y'all have any questions? Okay. So the financials, I'm going to go through these pretty quickly, because they're, like I said, they're going to reflect the financial statements or the audit's going to reflect the financial statements that we just went through. The main thing I wanted to highlight in this audit report is right here in paragraph under the section that says unmodified opinion on the regulatory basis of accounting. This is from the auditors, and our auditors are RFH PLLC. And we have Taylor County audited every year now, just so you guys know. I don't know, I'm sure y'all have caught that by now, that we just started doing that about 3-4 years ago. We started auditing Taylor every year because there is a Department of Labor government rule that says if you have $500,000 of expenditures every year, you are required to have an annual audit. If you have less than 500,000, it's just once every 4 years. Well, as you saw, you had 448,000, but you guys are just a few chunk expenditures away of easily getting to the $500,000 mark. And there's a couple of years we were. So since we're so close to that point, we normally tell the auditors just go ahead and do an audit of your guys' books. It's never a bad thing to have an audit. It's always a good thing to stay clean anyway. So since y'all are so close, we always just schedule an audit now annually for Taylor County. But anyway, I wanted to refer to this paragraph opinion here from the auditors. They indicate to us the financial statements referred to above present fairly in all material respects the assets, liabilities, and balances, which basically in layman's terms means we had a clean audit. So the books and everything look good for Taylor County. This is the cash I just went over, that they match ours, what we came up with to the T. This is the financials I just went over. They break theirs out a little differently than we did. They kind of lump some things together, but basically it's the same categories that I just showed you on our financials. You'll notice it's the same surplus, same cash on the financials here. Here's notes. These are the same kind of notes that they give us every year. I'm going to kind of breeze through those because this is the same thing the auditors just tell us. They're showing reflections of our cash, how we're set up as an organization. All the same info we give us every year. They show us the related parties, showing the relationship between Taylor County and how they're part of the District of Lake Cumberland. And there is one that we read. I think we had this last year, but it probably would be good to read. There's a COVID-19 pandemic one that they added, stating that since early 2020, the COVID-19 pandemic forced certain restrictions in the U.S. and the state of Kentucky. The economic impact of the pandemic could result in a negative impact on the pasture district's revenues. It did not, by the way, but they had to start stating in their audits that it could, but it did not impact y'all's. The duration and pervasiveness of the pandemic are uncertain as of the day of these financials. The taxing district is continuously evaluating the impact of COVID-19 on its operation and finances. So they start adding that to all of our audits, just as a note they were required to add. The last thing I want to say in the audit is they also have to report in accordance with government auditing standards, since we are a governmental agency. So it's an audit that's also a governmental audit. And the only thing I wanted to read here is under compliance. This is the most important part in the letter here. The auditor said the results of our test disclose no instances of non-compliance or other matters that are required to be reported under government auditing standards. So once again, a clean government audit. So Taylor County is good on their audit. And that's it for the financials and audit, if nobody has any questions.
Okay, thank you for that. I guess the next item on the agenda is setting of the local tax rate, but of course we can't do that until we look at the budget numbers. And I guess, Ron, you're going to give us the details on that.
Actually,
Yes.
I think Dr. Rogers and Ron, if you don't care if I interrupt, I believe we need to accept the audit. I think we need to.
I apologize.
So
Yes.
Can we get a motion to accept that before we move too far?
So is there a motion?
I make a motion to accept the audit.
And a second?
A second.
Okay, all in favor, say aye.
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 Any opposed? Okay, motion carries.
Okay, now
So,
I believe we're ready to go ahead with the presentation of the budget and setting tax rate.
Okay, go ahead.
Okay, so the reason we always put the tax rate ahead of the budget, this is what Sean told y'all every year when he was doing this, is because technically we have to approve the tax rate first, but we always thought it was silly to approve a tax rate without it being included into the budget picture first. So that's why we want to show the budget with the different tax rates so you can see what you're looking at, where you're resulting in, because it can impact possibly what you're approving on the tax rate. But after I present the budget, you will have to go back obviously as normal and approve the tax rate first after I present the budget, and then afterward you can then approve the budget. So I told you a second ago, I hope everybody can see this. I'll try and zoom in a little bit, but to get the whole budget, I can't zoom in too much. I'm gonna zoom in a little bit though so y'all can see a little bit. Okay. So I told you I was going to tell you the balance. These are your cash balances as of December 31st, 2021, here at the top of this budget document. Your cash as of December 31st was $708,414. Your projected remaining receipts for the year is totaling $83,000. That's comprised of all the categories we said before. That's including real estate, tangible, motor tax, delinquent, and telecommunications tax. That's how much we project you're going to receive in those categories for the rest of the 6 months ending June 30, 2022. And this is the amount of interest we're projecting based on the cash balance you'll have from that for the rest of the 6 months. Totaling, you should have funds available roughly of $793,185 at the end of June 30, 2022. Your projected remaining expenditures, we've already had 1/2 of the district the district operation fee paid to us. That's paid the 2.8 cents fee to be part of the district. We've already paid the first portion of that. This is the second portion, the $225,197. That'll be paid sometime back to the district around May or June or so. So we have that to be paid. Tracy can attest later on or whenever if the grant's going to happen. We still have a grant that was budgeted that has not been completed as of yet. If it has been completed, we haven't paid it as of yet. So that expense is still supposed to occur. And then we got some, as you can see, some of these other various categories. I'll go through these quickly. Some advertising, $1,400 in professional services, $10,741 in maintenance and repair, dues and subscriptions, $1,165, board expense $500, furniture and fixtures $14,750, and equipment of $13,221. Where I arrived at some of these numbers, such as maintenance and repair and furniture and fixtures and equipment, those sound like big categories. Some of those are probably, a chunk of those are probably not going to get spent. What I normally do is I take the amount of budgeted we had planned on, subtract off what we spent, and that's what I came up with. But as you guys probably see from year to year, we never usually spend every penny of every budgeted dollar because, you know, we put in some miscellaneous costs and padding to make, you know, to cover some things like if an air unit goes out or a medical fridge has a problem and we have to do a major repair or major roof repair or something like that. We make sure and have cushion in there, and so that's what that represents. So more than likely, you will not be spending all of those categories like I showed you above in maintenance, furniture, and equipment. If that all was spent, your total remaining expenditures would be $282,553, leaving you an opening balance as of the budget year we're talking about, July 1st, 2022, of $510,633 in cash available. So that's going to lead us to our budget. So starting up here at the highlighted cash, we're budgeting, and so you know that I think Sean always announced this, but just so you guys remember, we pull, and I'll scroll down real quick and show you this. You'll see we pull our worksheet, all the real estate taxes and motor and tangible, all these amounts we get from this worksheet that's provided to us from the state, and they get it from the Office of Property Valuation. We get this once a year to give us estimates on how much or to give us how much our taxes were in 2021, and we base our estimates off that. So as you can see, this is the sheet we use, and all those are plugged into these calculations that you're seeing on your screen now. And that allows us to arrive at our numbers that you're expected to receive for your particular county. So based on those sheets, you'll notice we have 3 categories here. We have a proposed budget. If you guys remember, I always give you 3 columns. We give you a proposed budget at the rate you've been choosing, the current rate that you've been at for your tax rates, which is at 3.0325. We have a proposed break-even budget, which we'll get to in a little bit, and a proposed surplus budget. But what I'm going to be presenting is the first column here at your current budget, and then I'll show you the results of the other 2 after I'm done here. So your budgeted receipts for your current rate, Of real property taxes is 385,065. Tangible or personal property, whatever you want to call it, of $85,090. Motor vehicle of $55,379. Delinquent, which delinquent's hard to estimate. We don't have that on the document I just showed you. That's an estimate kind of based on last year, and that varies from year to year. Sometimes we get half of what we budget. Sometimes we get more. It just varies on how much the county's catching up their collections and everything like that. So there are other taxes. This is the telecommunications. We can normally estimate this pretty good. It normally is pretty constant month to month. So the other taxes basically represent your telecommunications tax we received every month. And then, of course, your interest income we're estimating based on your total cash value there as of 2022. So total funds available after receipts would be $1,056,315. Now we're going to get to the budgeted expenditures. So here is the normal. So based on the receipts that were projected, here's the 2.8 cent calculation to be a part of the district. Once again, the 476,598, that is annual. These are normal costs we have every year. We have 1,000 for landscaping, 2,000 for snow removal. I think I did raise that a little, if I recall, this year, because I'm starting to the fees for snow plowing and everything have gone up. Salt's gone up. A lot of stuff's going up. So I'm starting to raise some of those fees because it's starting to get kind of expensive. And if we keep having years like we've been having now with more and more with these bad snows and winters, then it'd be good to prepare a little more for that. So I put I think it used to be 1,000 if I recall, but I bumped that up a little bit. Shannon was telling me over at Taylor County, they're needing to fill and seal and strike the parking lot, and we had some initial estimates on that totaling about $8,000. And then we have miscellaneous in building maintenance repair 14, and what that is like I said, that can be something going on with the roof, just anything repair needs done to the building. But I really use that mainly for worrying about units going out, especially like in the winter or something like that. And I try and budget 2 units. And based on recent calculations, normal units, decent units run anywhere from $6,000 to $7,000 for an air conditioning unit. So I usually try and budget for 2 for every county. And then we go from there. So that's why that's at around 14,000. Moving on to furniture and fixtures. This is normal. We normally budget around $250 in seasonal decor. And once again, miscellaneous. So if it turns around, some of the chairs fall through or they break and we didn't anticipate it, we'll buy some more chairs, buy some tables that broke or something like that. That's to help cover items like that. And then moving on to equipment. This is an annual expense y'all have now every year where y'all have that really nice generator now to help power things like the fridges and some computers and things like that. Assuming the power goes out, like for example, in an ice storm or something like that, y'all have that nice generator now. We have a maintenance fee on that. The guy comes out and checks it once a year. The guy who installed it, he checks the fluids, checks everything on it to make sure everything's operating good. He does that once a year, and we pay him around $375, $400 for that. But in case he finds something in there, we put a little padding in there to make to help adjust for that. So around $500 for that. The miscellaneous computers and related equipment. The reason we started separating this is we started finding that a lot of our expenses in equipment were computer related. So anything you can think of that's IT related. So computers, printers, scanners, things like that are all going to be under this category. And if we get into other types of equipment, it could be something for using for something health related, like some kind of machine that we're using for I'm trying to think of things that we'd buy, like medical equipment or things like that. That would be under this other miscellaneous category of $5,000, totaling $15,500 for equipment. And then we have our normal category professional. This is the annual audit I was talking about. I bumped that up to $1,500 because the auditors, I think, is going to charge around $1,400 again this year, $1,450, something like that. And then advertising and printing, this is normal, $600. This is for your newspaper publications, like to advertise this meeting that we're having now and things like that, and to advertise some other things, $600. Dues and subscriptions. All these organizations we renew every year. We have the KPHA conference that we do, the KPHA memberships. We have the SPGE, and we have the CALBO. All those are programs that we're a part of, and those normally total. They vary every year, which is why I try and cushion a little bit. It'll probably more than likely be around $1,200-$1,300, but we always cushion that a little bit because sometimes they raise their fees without much notification and not before our meeting. So we go in and cushion that a little bit. And then miscellaneous board meetings. This is kind of a meaningless expense right now where we're on Zoom. We used to use this expense to cover food and things like that, but hopefully we'll be able to get back to doing that for next year's meetings. But as of right now, obviously that's not happening. So if something did come up that's miscellaneous, this category would basically cover that. If it's not covered in any other category we have listed here, we could use that. So anyway, total budget expenditures of $523,948. That leaves you with a total cash balance remaining, if all of that comes to fruition, of $532,367, with a budgeted net surplus of $21,735. And normally it's a little more toward break even because normally we do have mini grants. Normally we do have some other big expenses that are coming through here. So that's why you're showing that this year. I did show you a break even rate. I'm not going through the expenses again because they match. But there is I gave you the rate to have a break even budget if you so chose to do that. And I gave you a proposed surplus budget of 3.4, which is just basically just showing you how you're already in a surplus, but this just shows you if you doubled your rate where you would be at. And that is the presentation of the budget. Are there any questions before we move to the rate?
Okay, thank you for the presentation. Is there any discussion regarding setting the local tax rate? There's a couple of options there. Of course, I don't think we need option number 3, which is a surplus budget. And so it's really a discussion between the current rate or whether we should lower that rate, given the fact that we do have a surplus of funds available to us. So any discussion on that?
Can anybody remind us what we've done the last couple of years? I wanted to say always kept it.
It's been left as is. It typically gets left as the current rate. And typically, like I said, and like Ron mentioned, you all have mini grants and you've done some community-based projects for your area that have taken some of that surplus. So where it's showing a $21,000 surplus this year, that in the past has been much closer to a break-even budget. And that gives you a little bit of play and a little bit of wiggle room in case you do decide to do any kind of community-based efforts moving forward. I know Tracy has mentioned the health educators are very interested in doing some health fair type things, some offerings to the community that we typically haven't done in the past. And that's part of, I'll get into this when I get to the director comments, but part of what I hope to do with the health department is increase our image in our relationships across the community and reach out to partner with more different partners that we haven't been able to do previously. So it's totally your call on how you go about this, but over the past several years, and Ron may be able to tell you specifically, but over the past several years, it's been left at the current rate and we haven't increased or lowered. We've just kind of stayed as is, and it's been very close to break even by the time the projects got done.
Yeah, and I'll add to what Amy said. Occasionally, we'll have a board that they said for the next 5 years, I'm going to raise the rate. They had a plan in place. I'm going to raise the rate because I want a new building, or I want this. That's a little different than y'all's circumstance because normally that board after 5 years will then say, okay, hey, time has passed. Are we ready to drop this rate back? Which they knew they could already cover before that. They were just trying to add some funds to have a new building. And like I said, in y'all's case, just remember, without that kind of thing already happening, it's always, I'm sure all of you know this, but I think Sean usually repeated this every year, if you it's always easy to lower the budget because obviously that's going to make everybody around the county happy. It's really hard to lower it. And then if you have to bring it back up, as you guys probably know. So that I think that's another thing that leads to, in addition to what Amy said, knowing that this is kind of an odd year in the sense that we're actually budgeting a pretty good surplus here. Normally it's a little closer to break even. On that, in addition to that, just think about that if you think about lowering it, if we ever had to bring it back up for something.
There were also comparable tax rates in the materials that were given to us for the meeting for the other counties in the district.
I hope it's down.
Yes, yeah, that is right in line.
Yes, can you sign for those chairs for me? Thank you.
This is Dan. I'll make the motion. We made that,
It probably is. Sometimes they mail high to me.
Let me, before we go too far into this, let me say.
Like I took it off, I put it back on because I'm like, that margin, the regional, ridge looks too high.
Dr. Richardson, sorry. Thank you. I went back and watched last year's Board of Health meeting and it came up then, and I want to, in all transparency and fairness, remind you all, there has been discussion about compensating tax rate, whether that applies to local health departments or not. That's still up in the air and not been completely decided. Everything that I have been told and researched up to this point says that it does not, that we can leave things as is. But you may want to continue. Last year, when you made the motion to approve the tax rate, you made it in such a way that it was, we're going to approve the current tax rate at this rate or the compensating tax rate, whichever is found to be necessary for local health departments to utilize. So if you want to make the motion in that manner, that would cover either way and we wouldn't have to come back for a special called board meeting. It is my understanding, and we've been legally advised that that compensating tax rate does not necessarily apply to health departments, but that could change at any given time. So you risk, if you don't make the motion in a certain way, you risk having a special called meeting at some point to adjust.
So Dan, I think that you had made the motion. Do you want to change the motion or leave it as is?
I'll clarify my motion. We just do it as a clarification. I'll clarify my motion to that wording.
Okay, so
I'll second Dan's I'll second Dan's revised motion.
okay, so seconded by Jay Eastridge. Any discussion on that from other members? Okay, so all in favor, say aye.
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 Any opposed? Okay, motion carries to keep the tax rate at the current level. So now we need, and we've had presentation of the budget. Any further discussion on that? Okay, and so the next item on the agenda is term expiration for board members. Amy, I don't have the list of whose terms are expiring.
Actually, I think we voted on the tax rate, but we didn't vote on the budget.
Oh, okay, I'm sorry. So we need a motion to approve the budget as presented at the tax rate of 0.0325.
Yes.
I'll make that motion.
And second?
I'll second.
Okay. All in favor, say aye.
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 Any opposed? Okay, motion carries. Okay, so term expiration of board members.
Shannon, do you happen to have in front of you the ones that are expiring?
Sorry. Let's see here. That would be Lisa Halliday.
Is it Dr. Hayes?
Greg Tungett, Dr. Hayes,
And Dan, I think. Dan.
Dr. Halley, Arthur Halley, sorry, and Dan Durham.
So Dan, are you willing to participate the next year or for another term?
Yes, I am.
Okay, Dr. Hayes,
Yes, sir.
Okay, and so I don't, Lisa, is Lisa present?
She is.
Yes.
Yes,
Okay, Lisa, you willing to participate for another term?
yes, I will.
Okay, and so Greg Tungett and Dr. Haley will need to reach out to and see if they are willing to stay on as board members. And if not, then we'll have to find new ones. Anybody have any issues with that?
I think Shannon will be responsible for reaching out to these members and getting the paperwork that's necessary to reapply and get that all taken care of for you all. There's an online process now for submission of your credentials and everything. So Shannon will help coordinate that for everyone.
Okay, thank you. Thank you, Shannon. Next on the agenda is election of chairperson and officers. Now, our current officers are Gail and Dr. Richardson. Is that correct?
Our current officers, the chair is yourself, Dr. Rogers, our vice chair is
Right.
Dr. Richardson. And then our board of health members to the district board are the judge executive, Dr. Phillips, and Dr. Richardson.
Okay,
So let's start with the chair and the vice chair, if you all continue to want to continue in those roles, I guess.
I'm willing to, unless somebody else wants to take over, but I'm certainly willing to do that.
I motion for that to continue.
Second,
Is that for
Okay.
the full slate then?
So
Or
that-
Dr. Richardson, are you willing to continue on also?
yes, I will.
Yeah, that was a motion for the officers to remain the same. Sorry for
Okay.
clarification.
Perfect. Mhm.
Okay, all in favor, say aye.
Uh,
Aye.
Aye.
Any opposed? Okay, so we will continue that. Now, did that include the representatives at the district board?
That did not. And also I
Okay.
need to, as a point of clarification, I need to make sure that you all are aware, we'll need to appoint a secretary for the board. That has traditionally been Mr. Crabtree, and since he is retired, that can be me if you all choose for that to continue on as the director in that role, or that can be a local health department employee there, whatever your preference is. In the past, Mr. Crabtree has performed that duty for you all because it gives us the ability to sign contracts and do some business on behalf of the board as needed. So if that's something you all want me to continue to do, I will be happy to do that also. It's your decision.
I think
I'll
that
make
makes
that
sense.
motion if you're. I'll make that motion, Amy.
Okay, thank you, Jay.
So we need a second.
Second.
Okay, was that Dr. Hessen?
Yes, sir.
Okay. All in favor, say aye.
Aye.
Any
Aye.
opposed? Okay, motion carries. So I guess we need to talk about district representatives.
Yes, and the county judge executive is automatically on the district board as a representative. So we have Dr. Phillips and Dr. Richardson that have been appointed from this local body to serve also. So if they're willing to continue, you can keep that, or if there needs to be a change, we can entertain that.
I'll continue.
Okay, I guess we can appoint Gail in her absence, and then if she does not wish to continue, she can let us know, unless somebody else would like to be appointed to that position. Okay, so I guess we need a motion in that regard.
So moved.
Okay, and a second?
Lisa Halliday, second.
All in favor, say aye.
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 Any opposed? Okay, motion carries. And then now we're to Executive Director's Report, Amy Tomlinson.
Okay, I will try to be brief. I just want to basically introduce myself to you all. I've met the district board members several times and I have not, this is my first local board meeting that we conducted. These are only annual meetings. And so most of you all I've met before, but a few of you I haven't. So I apologize that this has to be virtual again this year. I'm truly hopeful that maybe next year we'll be back to being able to do some things face to face. So for those of you that don't know me or that we haven't gotten to meet in person yet, my name's Amy Tomlinson. I was appointed to the director's position on June the 14th of last year. I actually became fully the director on August the 1st after Mr. Crabtree's retirement on July the 31st. While I'm new to the director role, I've been at the health department for 17 plus years. My previous role at the health department was the preparedness emergency disaster planning manager. So I have been involved with COVID response from day one. And so it made perfect sense. And it was actually a good thing that during the middle of the COVID, where we thought things were going down last summer, Mr. Crabtree stepped away and then I was able to step in, and we didn't necessarily have to start leadership for the health department with someone from the outside who didn't understand the COVID response and some of the things that were going on. It would be hard enough under normal circumstances to step in a role like that. But with Delta surging at that point and just beginning, and then now Omicron, we really at the health department could have been in a much worse shape than we are. The COVID update that I want to give you all, and I know everyone is sick to death of hearing about COVID and we're so ready to move on. I just want to give you all an update. We are actually having a media brief this afternoon at 3 o'clock that will be live streamed on our YouTube channel, where I will answer questions. Our medical director will be there to answer questions, our director of nursing also. The update that we're going to give is basically saying that at this point in time, the health department is refocusing our efforts due to the surge. We have so many thousands of cases that have been reported to us across the district over the course of January with the Omicron, that we are very far behind on being able to process those cases quickly and update our numbers and things like that. So we have transitioned from doing local reports like you all may have been used to seeing on our webpage and on our social media, the local numbers and things getting shared. That will now be the state report that is getting shared, because those numbers at this point in time are more credible and more reliable, and it's easier to explain at this point those numbers than ours. A lot of the numbers that we're reporting, some of them are current cases we have prioritized and are working school-age children, those at risk, 65 and over, those in congregate settings such as jails, long-term cares, those kinds of things that are the highest risk groups continuing moving forward. We're still working those cases daily, but we are also trying to work the backlog of cases that we have developed. So some of the numbers that we report every day are older cases that aren't current cases. So it skews the numbers. And then also you all will remember around the first of the year, the quarantine period changed. So the current guidance now is 10 days of quarantine for positive cases, but if you're asymptomatic and or your symptoms are improving and you're fever free for more than 24 hours, you can come out of quarantine or isolation on day 5. So that shorter isolation period now has also skewed some of our numbers, because by the time we get a report of a case and get it worked and get it reported, that person is basically turning around and being released from isolation. So it's very difficult. It's been extremely challenging with all of these changes and things to make our numbers understandable for the general public. So rather than cause confusion and all the things moving forward, we decided we're going to go with the state numbers. And the state has updated its processes considerably over the course of the pandemic and over the last couple of years. Early on in the pandemic, they didn't have the processes in place and we didn't feel confident. We felt like our local data at that point was much more reliable than what the state was reporting. Because of the technology and the advances and things that they've made, the state numbers are generally much more reliable now. And I feel better reporting those and going forward with those at this given time. For Taylor County specifically, I wanted to point out to you all the positivity rate for the state in general, as of yesterday, was 27.51%. That is actually coming down. The peak of it, I think last week or the week before, was around 32, 33% positivity for the state. we don't report positivity locally. We never have during the course of this pandemic because so many different providers are doing testing. We would have to take each provider's info and kind of congregate that and put it all together and share that out. And it just wasn't feasible and wasn't possible to do on a timely manner. So we've always used the state positivity as ours. The incidence rate specifically for Taylor County was 151.9. And you all know the color coded chart. You're familiar with the colors, the green, yellow, orange, and red. That puts you firmly in the red. The red is still 25 and over. So anything over 25 is reported as red. So you all are 151.9. And just for a reference to think of when Omicron started around Christmas, New Year's, the January 1st incidence rate for Taylor County was 66.5. So over the course of a month, we've gone from 66.5 in your county to 151.9. The total number of cases reported for January, according to the state data, was 1,224 cases just in Taylor County. Last week alone, there were 364 cases reported for Taylor. And then there were also 6 deaths reported for Taylor County in January. And in general, deaths are slower to be reported than the cases because sometimes it takes longer to get that process worked. The state is still doing verification of death certificates and things to make sure that it truly was a COVID death relation and not just, a person who died with COVID, but not from COVID, if that makes sense. So they are very cautious in the way that they calculate that and report it. So if a person died in a car wreck but was COVID positive, but the cause of death was the car wreck and not COVID, they don't count that as a COVID death. So that's where things are. For our own staff at Taylor County, I cannot say enough good things about the nurses and the staff and the contact tracers and the clerks and everyone who has pitched in and gone above and beyond for this, well, the course of the pandemic. But over the past year, we have looked at vaccination clinics on-site, off-site, doing things where we can. We've partnered with treatment facilities, the jail, just all kinds of congregate settings. We've done food pantries. We've done all kinds of things. We have partnered with the school systems, and while we're not technically providing the services there in the schools, we're not doing the testing and the vaccinations there on site. They have their own partners for that. We have provided guidance and help and support for them throughout this. The Taylor County Health Department, I had a report ran just for your all's information. The Taylor County Health Department alone, over the course of the last year, since vaccines became available, have given 3,468 vaccines. That is doses administered. That's not necessarily individual people that have come through. That may have been, we may have given a first and a second dose and a boost to the same person. So this is total number of doses administered, but that is a tremendous amount of work that has gone in on behalf of our staff at the health department, just in unprecedented times. You all know, I'm not telling you all anything you don't know, but when people come in for this kind of thing, or when they call the health department, they're not always necessarily the kindest. Sometimes it's the people that are at the end of their rope and they're needing help and they're needing answers and that kind of thing. So I just want to applaud the staff locally, and I know you all are proud of them, and I just want to sing their praises because this is truly something that we could not have gotten through without the amazing health department staff. On saying that too, I will tell you that we are no different as an agency than any other agency than you all, that I'm sure you all are seeing the same staffing challenges and things moving forward, being able to recruit and retain staff, and also being able to stay open in the face of these surges of sickness, because even though we're vaccinated, a large portion of our staff are vaccinated, we can still get sick too. We still have breakthrough cases and we still get sick. So just maintaining staffing levels across our agency is a challenge. But over the past 2 or 3 months, I think, I don't remember the exact date she came on, but we now have a full-time environmentalist in Taylor County that is stationed there. That's been a position that has been very difficult for us to fill over the past few years due to the low starting salary and the recruitment piece there. We just hadn't had qualified candidates that we could get and keep there. So we now have someone in that position, and she's doing a great job. She's going through her training, it takes sometimes a year's worth of training for environmentalists because there's so many specialized pieces to that of what they have to go through and train for. So it will be a while yet before she's fully able to work solo and independently, but she is there now on staff and training and getting her feet under her too. So we are happy to have her on board and happy to have that position filled after quite a challenge. We did ask the district board to look at raising that entry salary for that one series of positions, and they approved that. So after that, we would have been able to fill 2 positions that had previously been vacant, one in Taylor and one in Casey. So I'm very thankful for that moving forward, and I'm very hopeful that now Campbellsville and the Taylor County community will be better served since we have someone on there now. And that's about all I have. I'm happy to take questions if you all have anything for me about COVID or the health department in general, or about me personally, whatever you all need to know.
Thank you, Amy, for that report. We certainly appreciate all the efforts, both at the local and the district level during this time. Anybody have any questions for Amy?
Amy, just a quick question on COVID tracing or contact tracing. What does that look like when we have a positive case at the pharmacy and send it over to you guys? Is that getting done? Because we try to do that when we have a positive, sort of get to the bottom of who all they've been in contact with, but it's not really an official contact tracing. Is that
Right.
something that's still happening, or I understand there's a backlog and that sort of thing, but if you could speak to that just a second, if you wouldn't mind.
I wouldn't mind at all. Thank you. So Jay, the way it's working is we're working the cases that are in the highest risk settings. So we're trying to look at like children who may be in a daycare setting or schools or those kinds of things. But everyone else, if it's just a general public case, we're heavily relying on providers to give them information. We're also relying on the public to know what to do at this point in time. We're so far into this now that, we cannot possibly contact everyone. We are going to, on our media brief today, we're going to unveil a new piece that we are offering, and this may be beneficial to you all, and you can pass along to your patients and your clients too, your customers. We have developed a calculator that we're putting on our webpage that the person can then go into and plug in the date of their symptom onset, and it will calculate their isolation period and when they should be released and all the factors. So that is going to be something that we advocate for moving forward. If they receive a positive test and they need a letter of release or something from the health department, because we're not able to do that anymore for employers and schools and all the things, they can use that calculator on our webpage. And there's also a print feature now also on that too. So they can take their positive test in this hand and their release statement from the health department, the new calculator feature, and use those 2 pieces together to take to employers and that kind of thing. But we are desperately trying to get word out, and that's part of our refocusing and re-strategizing moving forward with COVID. We're amping up our education efforts on who needs to be vaccinated, what to do if you're positive, those types of things. So social media, our webpage, those kinds of things drive people there. And if you have people who don't understand what they need to be doing and you don't have time to educate everyone who comes into your facility and your pharmacy, drive them to our webpage, because we're really working on beefing that up and making sure the right guidance is out there. There's that document that the state has it's 10.5.10, and you all probably have seen it. I will try to pull it up and show you if I can get my screen to share. Let me see if this works. This works for you all. This is the state page I'm going to share, but we also have it on our own page. You all see in the red state, the red map. This document right here, this 10.5.10, this is the current guidance on who needs to isolate and quarantine and what the recommendations are. So this is what we are utilizing heavily and advocating. So hopefully that makes sense to you all, and you know where to go to get that, but we also have it on our own page.
Thank you. I think that'll be helpful.
Okay.
Any other questions for Amy? Any other questions? Okay. Well, I appreciate everybody's time today. Thank you for tuning in for this meeting. Does anybody have any other items or any other issues they would like to discuss during this meeting today? Okay, can you guys hear me?
Yeah, it's just a quiet group today.
Yeah.
Okay, I know. I thought I was on mute maybe. So anyway, I guess at this point, it concludes the meeting. We just need a motion to adjourn
I so motion, Dr. Hess.
and a second.
A second.
Okay, anybody opposed? Okay, motion carries. So thank you all for coming. I appreciate that. Thank you, Amy, for your report. And if you have any issues, Amy, that you need to talk to me about at the local level, feel free to just call me on my cell phone.
Will do, sir. Thank you all so much.
Thank you, Amy. Bye-bye.
Bye-bye.
Thank you. Bye.